first. It's a pleasure to be here. Thank you so much for being a part of this discussion. My role here, just saying a little bit about myself, I'm the director of North Shore Headache Clinic along with the North Suburban Wellness Center. In my center, what I find amazing is that patients come in oftentimes with a wide range of complaints, and oftentimes they're looking for answers and looking for directions of treatment that may be a little bit out of the box. And my discussion today will be specifically on whole body vibration, specifically using the power plate. And hopefully I'll introduce to you a really unique, novel mechanism of addressing complaints, addressing symptoms that patients may have that aren't addressed with traditional approaches. And for those of you that treat patients that tend to not respond to our traditional modalities, you will find this to be a very unique modality. So let me tell you a little bit about it. Whole body vibration. First, let's just define some concepts here. Vibration itself. What is vibration? We're specifically talking about mechanical vibration, not electric, not looking at heat or sound, but mechanical vibration, also known as oscillations. And this is a periodically repeated inversion of the movement direction. You can have harmonic or non-harmonic vibration. And when looking at the power plate, we're looking specifically at harmonic vibration. This is predictable. This is very it's repeatable, predictable vibrations. And some characteristics of the power plate vibrations to keep in mind. First, looking at its unique multi-dimensional, multi-planar platform. The direction itself there are three different directions. You have the up and down, forward and backward movement of this power plate. And this is very unique. And as we move forward, I'm going to describe why this triplanar direction is very important in treating different types of ailments. Characteristics also of the plate, some other things that are actually modifiable, specifically the frequency. Now, the frequency is defined as the number of times per second that the plate moves up and down. And specifically, it's expressed in hertz. And for example, if you position the individual on the plate and choose a frequency of 25 hertz, what that specifically means is that the plate is moving and dropping at 25 drops per second. And this can be modified depending on what is looking to be generated. The air also is another modality depending on the type of device that's purchased, but the air actually can be modified. And for example, let's say there's a heavier individual that steps on the plate. Well, this increase in weight is actually going to decrease the amplitude, which is the movement distance. And to increase the force that's applied against that individual, one needs to increase the air. So what's nice is that you can actually modify this device in order to achieve different types of results for the individual. So let's go into the actual, some more about pathophysiology and what we're trying to target here. Now, I love this being a neurologist in that this plate actually is addressing a very unique feature, and that is it is actually activating specific reflexes in the body. Now, we all attempt to maintain homeostasis. Once we are activated in any respect, once there's a stimulus or any kind of provocation to the system, our body naturally will respond. And in a very classical way, when you look at the reflex arc, all right, we have the 1A sensory afferent fibers that are sending signals into the spinal cord, and then in response, the classical reflex is to have elicit a motor neuron response, which is the effector muscle will contract. Well, let's take this further and look at the plate itself. The plate itself, the plate is actually, with its this vibration, there's actually a transduction of this vibration to the system. There's an activation of those sensory fibers that typically would get activated. For example, if you're hitting the Achilles reflex with a reflex hammer. The same idea if you put a patient on the plate, when the plate is dropping with this frequency, every drop, every change that sensory neuron is taking in, that's going to elicit a response from the nervous system. And what's interesting is this response itself can be involuntary. So you're tapping into an involuntary reflex arc, and then add this, have the patient actually activate the muscle. So you can tap into an involuntary response system and a voluntary system. And what I think is interesting here is when we look at the monosynaptic pathway, which is that involuntary reflex arc, To take it clinical for a moment, let's say we put a patient on the plate that has cerebral palsy and has a limited ability to move the limb or cannot move one side of the body, and that patient has no voluntary control of that set of muscles. Placing the patient on the plate, and specifically putting that area, that limb that is, voluntary under no control on the plate, that is, dropping at, let's say, a frequency of 25 hertz, the body has no choice but to respond by contracting. So take that from, I think that's really interesting, that if a patient can't voluntarily activate the muscle is activated because of that involuntary reflex arc. So that's one concept I think that's really interesting. So you're tapping into monosynaptic and polysynaptic pathways, which in many respects hits different targets, and we'll go into this a little bit. So this power plate itself is generating a mechanical vibration. The body transfers that vibration in different positions based on what the individual is doing. If the individual is standing on the plate, lying on the plate, sitting on the plate, you're going to activate different areas and different muscle groups. And then there's an initiation of reactions that occur at different physiological levels. So we've talked a lot about the neuromuscular system, but it goes further than that. There is an activation of connective tissue, the vascular system, hormonally. Because, as I mentioned earlier, the body is trying to maintain homeostasis. Once the body is provoked, your natural response is to alter your physiology, is actually to respond to that provocation.